I remember when I was younger and I heard the term menopause, thinking that it was some kind of mysterious, nebulous thing that happened to a woman as she got older. It was one of those things that wasn't really talked about a whole lot. It was kind of hush-hush, almost kind of shameful. Well, I hope to change that today. Just as important as having the talk about the birds and the bees and puberty to a young girl is important to understand about hormonally what's going to happen, emotionally what might change, physically what she's supposed to expect. It's just as important for a woman to understand what happens as the ovaries stop functioning and estrogen is not the driving hormone in the system anymore. So it's important to know this because the average life expectancy for a woman in America is around 80 or 81 years of age. So that means you have 30 years of life left ahead of you. If you want to be healthy and happy, you need to follow these tips in order to understand the changes that happen as you go through menopause and how to prevent chronic disease or conditions that can affect your quality of life. First, we need to define menopause so it's clearly understood. Menopause is defined as the final menstrual period, so it marks the end of reproductive years for a woman. Basically, for a woman in her 40s and 50s, this means not having a period for 12 consecutive months. Granted, this may be difficult for some women to identify. If you've had a hysterectomy, an endometrial ablation, or have a progestin-containing IUD, for example, a Mirena IUD, it may be difficult to know if you're in menopause or not because these things clearly do alter menstrual flow and cycles. So if you have questions as to whether or not you're in menopause, these are things that should be talked about with your provider so that you understand, is this menopause or some other condition that requires a different evaluation or treatment. 3 things every woman should know as she enters into menopause. Number 1 is once you've been declared menopausal, it is not normal to bleed. So any bleeding, regardless of where you think it's coming from, needs to be evaluated. Number 2 is bone density can really nosedive once you go through menopause. So every postmenopausal woman should be getting approximately 12 to 1500 milligrams of calcium per day. If you drink milk, that's approximately 4 or 5 cups of milk per day, and I'm talking measuring cups. And for some women, they think, ew, gross, I don't like it. Some women don't want the calories associated with it. Some women actually can't tolerate milk or dairy products because they have lactose intolerance issues. So just look at your diet, and if you realize you're not getting enough, then you should get a supplement. More is not better. Adequate is all we're looking for. Excess calcium can actually lead towards kidney stones, and I don't wish that upon my enemy. So just getting enough. It's important also to get vitamin D in your diet because vitamin D helps you to absorb the calcium significantly better. Also, weight-bearing exercise is vital. This weight-bearing exercise helps force the calcium to stay in the bones so the bones can stay healthy and strong. The third thing that's important to know is that cardiovascular disease is real. It is the #1 killer of men as well as women. It only takes women 10 years to catch up to a man to equal his risk of having a heart attack or a stroke. So getting regular exercise and decreasing all those other modifiable risk factors is going to improve your quality and quantity of life. So let's summarize. There are 3 things that every woman needs to know as she enters menopause. Number 1, bleeding is not normal. Any vaginal bleeding needs to be evaluated. Number 2, bone density can nosedive, so keeping the bones strong by getting adequate amounts of calcium, vitamin D, and weight-bearing exercise is vital to having strong bones. Number 3, cardiovascular disease is real. It affects women just as much as it affects men. So keep yourself healthy.